Hello, everybody. Good afternoon. We'll just go through some data, and then we'll take some questions. Good to see everybody again. I know it was a lovely week last week. Hopefully, everybody enjoyed the weather and phase 3 of restart. So, good news: no new deaths in hospitals over the last 24 hours. I believe our count, when we include our neighbors who we've lost in this process in both hospitals and or nursing homes, is at 180. So certainly, even though we haven't lost anyone over the last 24 hours, please remember these folks who we've lost during this process. Looking at testing and new cases, we are approaching 60,000 tests received since mid-March. Really incredible numbers if you think about where we were in the beginning of this process, in the opening days of COVID before we had cases, just getting a test and testing people for flu-like symptoms, and then the struggle it was in the beginning weeks to really just continue to test folks who were symptomatic. We worked very hard collectively to make sure that we could test our symptomatic individuals. Then we started proactive testing in a surgical way to hunt down the virus. And now with universal testing, these numbers don't even seem real when you reflect on where we've come. But yeah, over 60,000. Looking at the state's Eclairs system, now that we're doing so much testing, we won't report on the tests as they're done, but we'll report as when they're processed each time. But looking at everything over the last 3 days, we've had over 6,575 tests done in our central New York region. We've had a little bit under a 1% positive rate over the last 3 days, and over the last 24 hours, a 0.70 positive rate of infection. Again, early on when we're testing symptomatic individuals, these numbers were in the 8 to 8.5% range and have continued to go down. So good news when you look at where we are as a county, as a region, as a state. We're doing well. Universal testing, Syracuse Community Health Center. Again, anyone who wants to get tested, certainly I want to thank our partners at the Community Health Center, so critical in this process. Having this infrastructure built up within our downtown into our south side, into some of our census tracts that traditionally underserved, has helped us make sure that our minority communities have gotten the testing and had access to testing, so that some of these trends we've seen in other communities where the minority communities were hit specifically hard from COVID, we've made so much progress in that. And so I want to thank our partners that this was part of a strategy and has worked out well. Mobile testing, today and Wednesday, we are testing various independent senior living facilities. Again, hunting down the virus. We know it impacts our seniors more than it impacts our younger people. So we want to go and do as much proactive screening as we can. On Tuesday, we will be at Jamesville DeWitt Middle School on Randall Road in DeWitt to do testing. Anybody can stop by. You can go on our health department website to pre-register for an appointment as well. Tuesday is tomorrow. On Thursday, we will be at Roxborough Road Middle School, 300 Bernard Street in Mattydale in the town of Salina. Again, to do proactive testing. I want to thank Legislator Deb Cody for really helping us put this together with that. And so, again, we're going places, we're searching for the virus. Why do we do that? We want to identify it. We want to do testing. We want to quickly trace and quarantine and isolate. That's how we've turned this thing around. This is going to be part of our routine moving forward and certainly the foreseeable future. Again, we looked at our stats, 2192 over the last 3 days on average for the region, more than the 775 daily that we need as part of Restart. Again, I want to thank our partners in Cayuga, Cortland, Madison, and Oswego counties. This has been truly a team effort, and so we're so proud of the partnerships and the friendships we've made with everyone. Looking at our hospitalization rates and numbers, we have 42 individuals in the hospital. It's down 1 from yesterday. 8% of our active cases. Out of the 42, there are 16 people who no longer need to be hospitalized. They're just waiting a negative COVID test. So really, we have 26 individuals in the community right now that need full services of the hospital related to COVID-19. We have 9 in critical condition, down 1. Representing 1.8% of our active cases. Out of the individuals in the hospital, 25 are Caucasian, 11 are African American, 2 are Asian, and 4 individuals have not shared their demographic information with us. To date, we've had 342 people that have been released and recovered from the hospital since March. And when we look at our overall positive cases, up 19 on the day. 2,576 positive cases since March 16th, the first day we had a case. 4 of these are household contacts. 5 of these are affiliated with senior living facilities. 10 are community spread. When we look at our 7-day average on community spread cases, it's 7. So good numbers overall. We've made significant progress over the last week with active cases. We now have 504 active cases, down 20 since yesterday. A week ago when we were reporting and having these number was close to 1,000. So the many recoveries. We now have had 1,897 people who have recovered. That's up 39 since yesterday. And out of our 504 active cases, over 200 of them are related to senior facilities and nursing homes. Very good news on active cases and recoveries for the county. Looking at a little more information on who has been impacted by COVID-19 since this started. 1,530 have been female and 1,044 have been male. 145 are under 19 years of age, 441 in their 20s, 339 in their 30s, 313 in their 40s, 393 in their 50s, 318 in their 60s, 256 in their 70s, 229 in their 80s, 142 in their 90s, and 2 individuals we don't have the information yet on as far as their age goes. Certainly, we've seen a little bit of a trend recently with, let's say, our 17, 18, 19, and 20-year-olds. It makes sense. These are folks a little bit more active, hanging out with folks maybe in larger settings, larger groups. Certainly, we've seen some of those numbers increase a little bit over the last week to 2 weeks as the weather has gotten better, as we've moved in to different phases of restart. But when we look at our cases overall, certainly the facility spread in our senior facilities going down. That's critical, especially because that leads to hospitalizations. Community spread numbers are better now, second week of phase 3, going into phase 4, than where they were even going into restart. Household contacts will come with any positive case. So we're pleased with where we're going as a community. We just need to remember that this virus is still here, and the more and more liberties that we get back and our independence from this virus we get back, for us not to end up in a situation where we're sick or we're infecting people that we love, we need to continue to do what works. Try to physical distance at all times when you can. Certainly wear a mask when you're out in public, and we'll continue to make significant progress with this virus. I can take restart questions. I had a control room call today. certainly we anticipate the Phase 4 restart being either on a Friday or Saturday. We anticipate that some of the governor's healthcare advisors will start reviewing our data probably mid to late week. Certainly, we haven't seen anything to suggest that we're going backwards at all. And so that will hopefully lead us into a position where some of these businesses that have been waiting anxiously will be able to operate. And what capacity they'll be able to operate at, we don't know yet, but certainly we may anticipate a phased-in capacity approach to some of these entertainment type businesses as we've seen previously. So we're excited about Phase 4. We've gone through a lot together. Getting to Phase 4 will be a big milestone for everybody. And certainly then it's about getting things to full capacity and then continuing to fight and live with this virus in our daily lives. Budgetary realities of our county are becoming a real challenge. Looks like our friends in Washington, D.C. are going to move back from what could have been July action to maybe even August action. That's going the wrong way on the calendar. Local governments, state governments need time to know what our partners in the federal government are going to do. We've always said no is an answer. To us, it's not an acceptable answer, but that gives us more time to make the decisions we need. So I certainly want to implore Leader McConnell in the Senate to please take up a bill and help make the states and local governments whole of the revenue we lost during the period of time that everyone agreed we needed to be shut down to fight this virus. So that clarity helps us deal with the budget gaps we have. I ordered our CFO to take another $1 million worth of austerity cuts today to various supply lines in our budget. There's not much left to cut. So the reality is that if our friends in Washington don't act and act soon, we will have very bad choices to make that will impact people's lives. So saying that, take questions.
On that point, you've said that the local representation is supportive of what you want. Katko, Schumer, Gillibrand. Have you reached out to higher levels than them to see if you can perhaps influence beyond the local representation?
Yeah, we communicate ourselves and with our Association of Counties. We communicate with the White House directly through their government teams. We've been communicating, and I know Congressman Katko and Senator Schumer have been pushing in the Senate. I think the reality that some of these southern states are seeing this virus impact them now in a way that is different than where it was. Again, it's hot in these southern states now, more people going indoors. That's good breeding ground for the virus. They're seeing more cases. So I think that will create a sense of urgency to respond with some of these senators who are in the majority party in Washington. So that's our hope, Andrew. But we're doing what we can do. We at the National Association of Counties, we've been very active with the state, with NISAC, to help craft bills that would be fair to counties. Specifically in New York State, counties have handled the response to this. That's not the case in other states. Towns have health departments and cities do this. But in our state, we are the ones who have had the costs put onto our budgets, and we share sales tax with the city. But again, for every dollar of local sales tax, 75 cents comes to your county government, and we are losing all that revenue. So we've been hit really hard. And so we think there's fair bills that are out there. They don't solve our problems for us. We think they're fair, though. And certainly we need Leader McConnell to move forward with it at this point. And then the House and the Senate then need to get to a point where they can agree on a bill. Certainly the House passed a bill. It was very friendly to local governments and state governments, but we knew that was never going to be the end result. We didn't get excited about that. we know they got to get to conference committee and iron something out.
Speaking of that bill, though, Congressman Katko voted against it. So are you confident that he's working?
Congressman Katko signed on to a bill that we from NISAC put forward all of our weight behind. Look, when you almost put forward a bill and take a vote on a bill that has no chance of passing the Senate, it's almost a vote that you're slowing down the process by moving forward with that. The Delgado-Zeldin bill, which Katko sponsored, bipartisan bill, 2 congressmen from New York State, 1 Democrat, 1 Republican. That bill we were very involved with. If that bill started the discussion, I think you probably see the Senate closer to getting to the table right now. But certainly we need help. We'll take help any way we can get it. The suggestion that some gyms aren't following the rules is not a suggestion. Some gyms are not following the rules, and certainly we have other businesses that aren't following the rules. And we have fined businesses. We have sent inspectors out to businesses to plead with them to do the right thing. At the same time, we get a narrative that's true, is that there seems to be pressure on selective enforcement of the rules based off of mass gatherings that are allowed to happen and then businesses that aren't allowed to operate. So local governments are in a very bad spot right now, Jim, related to this phased-in process on business when there's mass gatherings happening in the community that are very hard to enforce related to physical distancing. So we are regulating with, and we have issued fines, and we will continue to do that. But to think that our 4 people that we have to address this can address this with every single infraction and every time it happens is just something we don't have that infrastructure for. But we are taking it seriously. We are addressing it as the complaints come in. It makes it harder to address the gym issue on the eve of Phase 4 when they're going to be opening up. And when business owners are looking at technicalities and gray language, it's a challenge. And we knew in this process this would be a challenge, specifically in the later phases as companies are desperate to feed their families and small business owners to get any revenue in. So we're doing the best we can. People are breaking the rules. We are enforcing it. We are trying to get to everybody when we can see it happen. The reality is we cannot get to everybody when it's happening. So then we go back at it the next day when we get the complaints.
Speaking of mass gatherings, who dropped the ball to allow an event with a few hundred to a few thousand people that resulted in 9 people being shot?
I haven't seen the reporting on or been briefed on how somebody felt they could give the green light for that event to happen. My understanding is there's reporting that one individual did that. Certainly it wasn't our office. But you can't, that's the challenge in this. If you're going to have 1,000 people together, 500, 250, and it's not sanctioned by the right regulators or authorities, people see that. People who are on the sidelines get frustrated when they can't provide for their families. Then one set of rules applies here and not here. So this puts us in a bad spot locally. And I don't know the end of that story for that specific example. Certainly there was a very negative outcome of that happening. And we want to be supportive of the community and the city to help any way we can with that negative outcome.
The mayor told us Saturday the city did not give approval.
They did not.
But the Near West Side Initiative at least gave their space, which is that park where this happened. So at some level, some more than an individual, some sort of organization seemed to sanction what appeared to be that event. Maybe sold it as a Black Lives Matter event when it was actually a party. But it sounds like there was definitely something, it was a well-promoted event.
Yeah, that individual shouldn't have done that. or individuals. And of course, that individual or individuals didn't know what would happen. But the reality is we have cases. Most of our community spread cases are driven towards younger demographics getting together in settings that are more social in nature. And so putting 400 or 500 people together in what is not a contained setting or structured setting, just having a social party, I get it. The weather's great. Like, you want to get together, you want to celebrate, but that is something that you can't do during a pandemic.
Does it concern you that police were called to that neighborhood a few occasions in the hours before, and we're told we're patrolling during the party and did nothing to break up that group simply for the pandemic limits now, but then we know what happened after?
Right now, I'm not going to Monday morning quarterback that, Andrew. I don't know enough information. I haven't spoken to the mayor directly about that or the chief directly about that, what was done. I do know the gathering never should have happened. And there's right now complicated community policing relations that probably led to some of the decision making related to how to community police an event like that. But certainly the event never should have happened with that many people.
So phase 4, what are we talking about for people out there that wonder what this is?
Yeah, well, hopefully, my understanding, and again, I've been up here before and I've understood things well, and sometimes I haven't understood things as well, but I think we'll see our recreational businesses opening up, gyms. We'll see arts and entertainment businesses that certainly, if you look at some of the Most and Everson and some of these culturally significant venues for us, movie theaters. Now, is there going to be capacity limits on some of these openings? I think there probably will be. That would be something that certainly we would understand and could be supportive of. And then maybe a couple weeks later, you open up the capacity more. We've asked the state to open up capacity more in churches as you go into a new phase. Again, graduations, we think that you can have more than 150 people together outdoors in a structured setting where people are there making sure people physically distance. We think there's still schools that are kind of waiting on this guidance. So we're imploring the state to please consider that. But I think these are all things in phase 4 that happen. And then at some point there will be another date that will trigger probably the limitations on gatherings overall will probably be removed. I don't anticipate that date to be on Friday or Saturday.
What's the status of the transitional homes for nursing home patients?
Yeah, the knock on wood, I've not gotten answers from the state health department on that, but the crises has really kind of gone away because the folks that have really that funnel of patients into the hospital from our senior facilities has slowed down drastically. And so we still have 16, but at the same time when this first started, it looked like our hospital numbers were going up and up and up. And really what it was is that there were so many people just waiting and waiting, and your consistent funnel of people getting better and going home and then new ones coming in was still happening at the same time. Now we have a situation where we have people who are recovering, less people going into hospitals, and now we have these 16 individuals waiting to test negative. So we are still waiting for the state because we need to have this infrastructure in place ready for the fall if there's a second spike so that this doesn't happen. But the immediate need isn't as critical as it was 3 weeks ago.
What's the status of Destiny USA to your knowledge?
I don't know. I'm certainly frustrated that it's not open. Hopefully Friday or Saturday. If you think about it, the entertainment businesses in that facility will now be in the same boat in phase 4 that these other small businesses have been in since phase 2. We just can't penalize these business owners based off of a real estate decision. And what's unique about Destiny compared to other malls is it is so big, it is huge, and to suggest you can't physically distance is a lack of understanding of how big the facility is. And so I've been pleading in these control room calls every day. Many have. I understand the anxiety, especially when you look at things at the state level. Some states haven't done restart maybe correctly. There's little spikes here or there. We haven't had that problem in New York. Let's be cautious. For us, it's about doing as much as you can in a safe way. And certainly we are very, very comfortable that you can go to the mall and you can go to a store and you can stay 6 feet apart and you can wear a mask, which is, best practice.
Do the state leaders give you an update that it's just in the hands of the governor? They agree with you, but are waiting on him?
I think that's where the decision is right now, is when the governor's comfortable making that call. I think that's where it is, and we continue to arm our control group members with our opinions and our facts, and hopefully the message is getting up, and hopefully we'll have good news on that soon.
Are you concerned about a lack of communication from the governor now that he's not doing daily briefings, or do you feel like your control room calls are giving you everything you need?
Yeah, well, maybe we'll get more communication with the governor because he's going to not have to take so many questions. But I think I'm not really concerned. I think the governor's team has been putting out information again on the data. We've slowed down our briefings. We're still getting information out. I think it's important that we continue to talk the way we are today till we get through that final phase, so that these unanswered questions get answered. But I think overall, I'm not concerned. I think the governor is all over this situation, and just because he's not doing a daily briefing physically, I think he's still continuing to do a call. And I know that in the control rooms, we still have Director Driscoll and the operations chief of staff, as well as sometimes Kelly Cummings, who's the chief of operations for the state. So we still got some pretty good firepower in our control room calls. Any other questions?
The 150 gatherings, that's something you're pushing, that's not part of phase 4, that's something you're
Yeah, we believe that you can do more in an outdoor setting in a way where you have people that are structuring and keeping people physically distanced in a controlled way. We think you got to go higher than 150, and we think you can. If we didn't think you could do it that way, we would say we don't think you can. We've been very honest in this process about what we think you can do here as it pertains to Central New York and Onondaga County. And we've delivered good news and bad news consistently to different groups. So we think at this point where we are, when you look at the community spread numbers, when you look at our numbers overall, there's a way you can do these things and accomplish these. And there's many seniors and many schools that still want that opportunity at more of a traditional send-off. So we're pleading to give us that opportunity. Let us be responsible to regulate it. We'll step up and do that. Yeah, I think the intensity of the virus isn't there. I think that's because of really the response of the community at large, doing what needed to be done, keeping themselves safe, and then with our health department doing what they needed to do. But it's still here, and I think, and again, my own personal opinion is this is really a facility-driven virus, at least in our county, and that means in some of these facilities, if it gets there, and it just takes one person to get it there, it's going to have a bigger impact. And so that's where the testing and tracing comes in. You nip it right there. But yeah, if you look at going to the grocery store the way it's gone, we're not putting out a lot of notices anymore saying if you were shopping here, here, or here. like we were because the intensity of this virus and the progress we've made has made it more targeted. And so where are you going to find it? People who are more social are going to be at a higher risk of finding this virus somewhere in the community at large, or people who are confined to a specific space where they live or on a daily basis if that virus gets in that space. And then certainly if you're a household contact, if you live with somebody who gets it, you're confined to a smaller space. So that's what we're seeing right now. And certainly we're very happy that the facility spread in our senior facilities has been way down each day. And that is really helping us with these hospital numbers continue to go in the right direction.
I know the zoo has a sign-in sheet and some other businesses, and you encourage businesses when they open to do that. So when you could do testing and tracing, you would know. How much has that helped as restaurants and different things start to open?
Yeah, I would have to ask Dr. Gupta if they've had situations with restaurants through their registration systems yet, if they've asked for that information yet. I knew when we looked at the zoo specifically, that was in our mind, and I don't believe we've had somebody through the zoo yet that's been a COVID positive where we've had to go back and use that. But that's the way. There's technology now for these businesses, and I think it's utilizing the technology and knowing who your customers are and when they're there. There's value there, and certainly in what could be a new norm of COVID-19, I think those are valuable investments that businesses should consider making. Other? Yeah, so the legislature has a special meeting tomorrow. One of the items that they've been considering is the COVID energy surcharge, temporary surcharge on energy to pay for the COVID pandemic. I don't know if they're going to take up the COVID energy surcharge tomorrow or if they're going to take it up a week from now, essentially. They have a session in early July. But we can't, and again, this is kind of where my frustration with the federal, remember what we're facing. We're facing essentially $100 million hole, most likely. If we get good news in sales tax, that's good. I'm a happy guy. But I know we won't get good news, meaning that we're going to get back our money we've already lost. We're going to have at least 3 or 4 really nasty payments left. So we had more expenses with COVID. Our receipts have gone down in Q2. Our room tax is gone, right? And we already fronted all that money to these organizations, many of the arts organizations, the Visit Syracuse. We've gotten some amendments to those contracts, but we fronted money, so that's a loss. Our gaming revenue, second quarter, kiss that goodbye. And so new costs, revenue gone for a whole quarter of the year. And the way it's gone is draconian. It's not just off 5-10%, it's off 37-40%. And then you only have, it's mid-year, so I can't do anything. City budget, June to June, they could kind of address some of this. I'm a January to January budget, so I can't address this from a revenue side with the exception of the COVID energy surcharge. But we've cut now almost $30 million. We are planning on using $15 million of reserves. That leaves us about half the deficit. The Delgado, Zeldin, Catco bill might get us about 30, maybe to 40 million. If the state then doesn't cut us more, that leaves us, still a deficit, but maybe there's some things we can do to try to plug that. If the state cuts us on top of any of all this, we have real problems. So why June? Why the end of June? Not July, not August, not September? Is because whatever our hole is, we have to fill it by the end of the year, so it's compounded. So if we wait till September 1 and our hole's $50 million, that means for me to make up $50 million, I have to cut $150 million. And that might mean something just scary. So by acting mid-year, even if it's surgical with decisions that you don't want to make, that at least gives you a little bit more time to see if your partners are going to come through for you or not.
How was your Father's Day?
It was great. It was great. Jack, Maddie, and Andrew. Andrew, Jack got me a card, which is nice. Not the best artist, but he drew a picture of me. Then Maddie did a nice job. And then Andrew told me he was running around. He forgot to make me a card. And he was scribbling on a little piece of paper. And Andrew's my 3-year-old. But he told me today, as I was dropping him off at his babysitter's, that he's going to make me a Father's Day card today. So we'll see if he comes through or not. But it was nice to be with the kids. It was a great day. Hopefully all the dads enjoyed their day. And best thing about being a dad and enjoying that day is the fact that you got the kids and you get to enjoy them and all the joy they bring to you. Really, it's nice to be recognized, but it's really, we're very lucky as fathers that we have the children in our lives. Anything else? So I think we're going to do this again on Friday. Hopefully we'll have good news going into that with Phase 4. But again, I just want to thank the community overall. We've been through a lot together over the last, feels like years, but it's really been 100 to 120 days. And the progress we made is significant, and everybody should be proud. And hopefully on Friday we'll meet an